N5RTF, it's great to hear your voice. I mean, I'd leave it right where it is for now. And then, of course, as you say, you'll evaluate it later. You're perfectly understandable now that when you're out here a little hot, you can determine that when you listen. Thank you. It's great to have you on board. So, good morning, good afternoon, good evening. This is the Medical Amateur Radio Council Digital Voice Net. This is AA4FL. I'm in net control for this session. And the purpose of our net is to provide a discussion forum for current medical events and issues. Now, Marco members will act as topic presenters in general, but we do allow and encourage guests that are not Marco members to participate. So all stations, national and international, are welcome to join the net and participate in discussion. I'm going to drop one. This is a directed net working from a login list, so all calls will be directed through me in net control. We do keep a session log on NetLogger. Now, if you have NetLogger, you have an advantage. You can download the program on the internet, and the advantage is that you can actually see who's not only logged in but communicate with us through through the instant message portion of that. I just see Angie checked in WJ8B. So I just brought up the window and after this, you're not doing that before Andy. So that is one advantage for the net. Drop one. In addition, the net meets every Saturday here at 1500 UTC through link repeaters and Quad Data Array is a wonderful collection of servers. There's more than one server that allows us to, circumvent the digital modes to transcode and talk to each other using different ones. So some of us here are coming in through DMR, through Fusion, G-Star, etc. And that's the beauty of the voluntarism of the group of the Quad Net Array administrators. So here before you talk after you tee up because you need to give everything a chance to synchronize. Now, also, don't tailgate. So when someone else is finished, give it a break before you actually tee up. And that will ensure that your transmissions are being received accurately and not being dropped. So everything is properly synchronized. Again, this is AA4FL net control. Are there any stations that have emergency priority traffic? If you do, please call the net right now. Call the net control now. Are there any stations that are going to be limited time today? They're mobile, may not be in range of a repeater for long, or just they're multitasking and have an extremely busy Saturday. If so, make your call now. Well, no calls heard, so everyone here is fully available for a nice conversation and friendly banter back and forth as well. We don't have to limit it just to the medical topics, but do honor the 2 minutes. Make sure you drop your signal if you're going to speak for long. And also, just in case for technical reasons your packets have dropped and we've lost your connection, we don't want to have too long a transmission. So far, I have myself, WA1EXA, N3IM, N5RTF, N9OML, PY2BBQ, in WJ8B. Are there any other stations that would like to check in? So make your call this time to AA Force Help. There's other stations check in. Again, if you're listening, we do encourage that, but we also encourage you to check in so we know you're here. But I know I get emails telling me how much they appreciate our medical council members being present on the net, having discussions that benefit listeners. But you don't have to be just passive if you don't want to. You can be active. You're always welcome to email me too with follow-up questions, as well as any of us. Most of us have our email address posted on QRZ, and you may have specific questions for certain members. Each of us has a different perspective on medical happenings of the day. We have different medical backgrounds, the health fields, that is. Not all of us are physicians. We have pharmacists, we have dentists. So we've got a full complement of the range within our organization and many within the net that are here to answer your questions. Let me drop one. Well, we had an interesting week, a little quieter week, and certainly there was releases about boosters, at least on the Pfizer side, and where populations would be served by those boosters, and many more to come. I believe there's also information that went on this week about the 5 to 11-year-olds and getting those doses approved. So there's a lot happening here in Florida. It seems that there is a light at the end of the tunnel. I'm not sure if it's more vaccines being given or better compliance, but the rate seems to be going down. I know that's not true nationwide. So there's a lot of work to be done in making sure everyone's vaccinated. From that here locally, Florida again is often in the news as one of the states that tries to circumvent requirements for masking, especially with school children. So whether or not you consider that a political issue or not is up to the individual reader. But we do encourage vaccines here. I'll let it drop one. And actually, let's go ahead and have Mark, that we get one EXA, pick up the conversation. Go ahead, Mark.
Okay, WANEXA out here in Cape Cod, Massachusetts. We've had it's a nice week up here. Of course, we are enjoying what we call the shoulder season. A lot of the summer tourists have left, and those of us who live here are finally able to make a left-hand turn on some of these streets that we can't do anymore. So it's back to normal living again. And I tell everybody, we don't want to complain too much because it's the tourists that pay the bills. Drop one. Okay, as far as on the COVID side, just to kind of bring everybody up to date, I've been away for a week or so. Last week I was another public service demonstration at a local cranberry festival up here. So I wasn't here. As far as our trend, our trend is still decreasing at a positivity rate about 2.019, and it's been going down for the most part. We are still very low on our hospitalization and very low on deaths. I can give you numbers if you want. I had the opportunity to speak to a physician this week. Really, I was the patient, and he was a neurologist. He works over at the local hospital, Dropman, and he was telling me that there was no COVID patients in our ICU. We do have some in the hospital, but none in the ICU. So things are, like I said, getting back to kind of normal. Masking, it's voluntary. A lot of people still do, some don't, but like I said, the crowds are kind of low, and restaurants are not crowded as much as they were. The outside dining pretty much is stopped because the weather's starting to get too cool. So everything is going back inside. Our symphony orchestra started again. They had their first concert. So little by little, the theaters are opening up, and we're kind of trying to see what goes on here. Of course, everybody's wondering about any new strains that are we going to get. And I myself waiting another few weeks to apply to the 6 months wait. And I'm still not sure whether I and the Moderna one. I don't know if giving out Moderna third shots or not. Pfizer's. So that's what's kind of going on up here in the Cape. Uh, this is the best time of the year to come visit if anybody wants to come on up here. The crowds are low, the beaches are still warm, and the days are bright and sunny. So back to you, Jay. WA1EX.
Well, thank you, Mark. I do appreciate the explanation. Here in Florida, of course, we don't have the cold that sends people inside. So what happens here in Florida, obviously not follow the same pattern as other areas as people do move inside, especially if they're moving inside in public venues. Maybe not necessarily in New England, but could be in other parts of the country that becomes even a bigger issue for areas where people don't have as many vaccinations enforced. Yeah. Again, thank you for the perspective, and thank you for. I know you do have a few guests who are retired pharmacists from the city area, so we do appreciate you taking the time to be with us today. By the way, Hilton PY2BBQ has posted a link to the YouTube video, a live YouTube video of this session, so anybody would like to partake in that, that link is up here. Acoustic message aspect of NetWalker. Next on the list, Keith, N3IM. Good morning, Keith.
Hey, 4FL and the Marco Group. This is N3IM. I don't have a lot to add. We have been fairly open in Pennsylvania. The recent flooding did not cause any problem. The recent Penn State game did not show any increase in COVID related infections. As noted in the CDC, the only one being problematic at this time is the Delta variant, being responsible for more than 98% of the infections. And they've placed the Alpha, Beta, and Gamma variants to being monitored only, as they have attributed to only less than 0.1% of the infections occurring in the United States at this time, which may be the reason we're not seeing the death rate as high as we did earlier. That and the fact that 55% of the population is now totally vaccinated, that also helps. So that's all from here. Oh, by the way, the reason we have flooding with 3 to 5 inches of rain is because mountains act like funnels. They funnel everything into the rivers, and the rivers have to take all that water. Center County actually declared a state of emergency, and that's where Penn State's at. So good thing it waited till after the Penn State game to hit us. That's all from here. This is N3IM. Back to the group.
Thank you for the report and the explanation explanation there on our discussion before the net started about uh, the levees getting close to flat. I apologize for my naivete on that. I'm not realizing why smaller amount of rain is more problematic there than it is here. Not only are we porous, but we're also flat. So again, apologize for not picking up on that earlier. Thank you for being with us, Keith. N5RTF, Chester. Good morning. I hope everything's going well, and I'm hearing where you're operating from today, as well as your report. Go ahead.
Well, good morning, everyone. I had a chance to look over this Yaesu and try to find where the microphone actually is, and I think I had my finger over it before. It's a tiny, tiny little pore in the front lower left. So maybe this sounds better. Our COVID fourth wave is gradually fading away. We are the opposite of the north. Everybody has been huddled inside air-conditioned buildings all summer long, and now we're down into the 70s and even the 60s, and people are starting to go outside. Businesses are leaving their doors open. People are leaving their balconies and windows open at night. So anything that's helped by a good airflow is probably going to be fine for us the rest of the year. The other thing I understand about the mountains, but I wanted Keith to know that we are now standing at 111 inches of rain since January the 1st this year. And we have not yet flooded in the French Quarter, mainly because of a very porous soil and good pumping system. But we got 3 months to go, so we're probably going to hit 10 feet of rain by the end of the year. N5RTF.
Well, thank you, Jeff. And actually, appreciate the explanation that I missed. Florida, that could be another reason why we're seeing our rates starting to decline, because we have the same heat issue. And here in North Florida, we are having the same weather that you are. So we're getting down into the 60s now at night, at least. During the day, it will take another month. But in South Florida, we probably still have people inside due to tropical heat. Thank you for pointing that out, Chip. And I know now this is AA4FL Net Control, the Medical Amateur Radio Council. Howard, Chip.
Good morning, Jay, and everybody on the net. This is N900. Sorry if I sound like I just got up, but I just got up. Not a lot of new news in our area. All metrics continue to slowly improve, with one exception. And that's the news. They've mostly been pushing the vaccine, pushing flu vaccine, which is now out and available, and expressing concern over the possibility of problems once we kind of move to our indoor life and have the potential for the double threat of COVID and whatever new variant may be moving down the line at that point in time with the flu. The only outlier is the PEDS emergency departments have been putting out information requesting that people contact their family pediatrician prior to trying to gain access to the emergency department for upper respiratory infections in children. They're having, like RSV seems to be running wild here, and they really don't want those kids coming into the emergency department. It sounds good, but in practice it seems that if you have a parent whose child has some sort of apparent respiratory distress, they're probably not going to be on the phone. They're going to call the emergency department. And most pediatrician practices, unless they're able to see the kid pretty quickly, are also going to counsel the parents to go to the emergency department. But that's at least been the discussion on TV. Other than that, we haven't had much new information to pass along to you guys, which at this point I think is kind of a success. Numbers are slowly flattening out, so we'll see where we go from there. And I know I'm out back to net control.
Well, thank you, Howard, for the report. We appreciate you being here every week and always participating with good input. Are there any other stations that are monitoring that would like to check in, like ask questions, and give you a chance to do a check into the Metaclimates Radio Council Digital Voice Net? This is Net Control, AA4FL, so late check-ins. Go ahead and make your call. Okay, no late check-ins heard. So far the conversation seems to be encouraging. I know the possibility of another strain is always a curveball. I hate to think that we can be definitive about light at the end of the tunnel, but at least it seems suggestive that we're taking a step-by-step approach, at least here stateside. Obviously, we need to solve the problems of the world as well, where other variants will come back to haunt us. The dreaded escape mutant, the variant that escapes the immunity of our current vaccines, the nightmare scenario. However, not likely, it's possible as long as it's circulating, and there's certainly be lots of hosts with potential for having those variants arise outside of the United States, and this connected world will certainly find their way back here if that occurs. So. Next, we're getting a little international perspective. PY2BBQ, Hilton in Brazil. Go ahead, Hilton.
A4FL and the group, this is PY2BBQ, Hilton from São Paulo, Brazil. And nice to be with you again this Saturday. We had a lot of rain. Now the sun is shining here. It's 20 past midday here. And yes, the picture regarding the COVID-19 here in Brazil, it's getting better day by day. The vaccination goes on very quickly now. More than 2 million people being vaccinated every day. And we have virtually the whole adult population vaccinated with at least the first doses, and around 70% of the adult population with the 2 doses. And we expect that by the end of October, we will have the whole population vaccinated. And what we saw was a decrease of the hospital beds occupation with COVID patients, although the number of new cases and number of deaths is still stable. For the last 2 weeks, around 30,000 new cases and around 500 deaths daily, with what is still very high. And the reinforcement third shot of the vaccine started 2 weeks ago with the older population, and now it will start with the healthcare personnel as well, because we were the first to be vaccinated early in January, so probably our antibodies are the lowest in the whole group. So the third shot is coming for us too. And yes, it's very nice to know that it's a great time to go to Florida or to Cape Cod, as Mark said. Wait one.
we got the news that the United States opened the frontiers to Brazilians who were fully vaccinated, but that will start only in November. And unfortunately, I had the possibility to go to Miami next month in October because of the World Congress of the International Federation of the Surgery of Obesity that will take place in Miami in October. But unfortunately, uh, I won't have enough time to go because it will be open just in November. I use it to travel to the United States every year at least 2 times for the congresses of the American College of Surgeons and to the meeting of the American Society of Bariatric and Metabolic Surgery as well. So, unfortunately, in the last few years, it was not possible, but hopefully we will have a chance in the near future to go back. So, that's the story here in Brazil, and back to the net control, A4FL, J, PY2, BBQ.
Hilton, glad to hear that things are looking up in your perspective, and that the same parallel happenings are there in Brazil. And it's not, of course, not necessarily the United States or Brazil that have us worried for the future. It's what might come out of other areas, very concentrated populations. I know you have that there in Brazil as well, but and certainly a level of other countries, there's potential hotspots for variants to arise out of. But that's nothing new to COVID. That potential has always been there for any virus, and certainly has been written about in the literature for years, both in the medical literature and scientific literature, and also in popular culture with many movies too. WJAB, Andy, thanks for joining us today. Why don't you get your chance at the mic here? Go ahead.
Well, good morning, everybody on the net. Here in Ohio, it's cloudy. It's only in the 50s. So, it was warm yesterday, but very cool on Thursday. Actually, playing golf on Thursday. It was only in the 50s, about a 20-mile-an-hour wind. We made it through it. Over here, still pretty darn high. The levels look like they've flattened out, but they're flattened out at a fairly high level. And positivity rate was right around 12.5%. It was that way last week as well. And I know they're busy, especially in rural hospitals. There's my daughter works in one of those. Has a 12, she's an ICU nurse, has a 12-bed ICU, and only 2 of them are there for non-COVID reasons. Some of the rural areas are having problems finding beds for people with heart attacks, thanks to the early people taking up the room. So, otherwise, not too much going on. I kind of look through the literature on a week long, at least daily, and didn't really see anything new this past week. I did try to pass on that article I talked about last week, but Google wouldn't let me send the email to the Marco address for some reason. So that's all I have this morning. Back to you, Jay from WJB.
Well, thank you, Andy, and I'm sorry to hear that I couldn't distribute that on the Google listserv. Feel free to, if you didn't already email me that one, that particular one, just send. Of course, I may not be able to receive it anyway, but I have a Gmail address. That's the one on QRZ. If not, I can give you another address to send it to. So just let me know by email. And I know that things have been a little more serious in Ohio than other areas and in certainly areas of Ohio, I'm sure is uneven throughout this country and different communities not having as many vaccinated, and that boosters aren't going to cure the lack of vaccination. So we'll still have an issue ongoing. Are there any individuals listening that are not Marco members that would like to ask a question? I'll give you a chance to check in and ask your question. If so, make your call. This is AA for phone net control.
Alpha Alpha 4 Foxtrot Lima, this is Victor United 3 Whiskey Tango Japan standing by.
Sir Sindhu, I have you checked in now. Glad to have you with us. I know the hour is not convenient for you in India. VU3WTJ, AA4FL. Sir Sindhu, from a standpoint of India, the conversation we just had about Brazil, there's pockets of areas of the country that are very dense in population in Brazil, but India has that problem many times over. What is the concern about new variant in India? And you were also looking into the epidemiology of the origins of COVID.
During the conversation, and my fellow officers are also sitting with me. They are also listening the conversation, and there are many specialists are sitting with me. Prosthodontist, endodontist, dental surgeons are sitting with me. So this is the thing. I was just monitoring, and I was enjoying the conversation. So microphone back to you, Alpha Alpha 4 Foxtrot Lima. This is Victor United 3 Whiskey Tango Japan. Over.
If anyone is copying Sir Sendo, could you send me an instant message on the net logger? And if you're not, please let me know. Otherwise, we'll go on with our conversation.
Yes, sir. Alpha Alpha 4 Foxtrot Lima. This is View 3 Whiskey Tango Japan returning. I am currently out of my shack. I am operating mobile. That's why I don't have my laptop with me right now. So this is the thing. Microphone back to you, Alpha Alpha 4 Foxtrot Lima. This is View 3 Whiskey Tango Japan. Over.
Thank you for joining us, Sir Sindhu. Can you tell us a little bit what's happening in India, the epidemiology research, the origins of Delta that you were doing, and any concerns about new variants coming out of the areas of India that are heavily populated and dense that could breed a new variant? Over.
QSL, the new vaccine is under development, and it is done by Serum Institute of India. So they are working on it. The final product is not out yet in the market. So we are also waiting for the new vaccine for the Delta variant also. So this is the thing. Microphone back to you, Alpha Alpha 4 Foxtrot Lima. This is VO3 Whiskey Tango Japan. Over.
Thank you, Sir Sindhu. I copied you that time. Sir Sindhu, I have a question. You have the vaccines. What about the vaccination rates? How many people in the big cities where a lot of people are closely living together have been vaccinated? Do you have any information about that?
QSL, per day, almost 1 crore to 1.5 crore people are getting vaccinated in India, and there is a very huge vaccination drive is going on all over the country. So this is a very big effort on behalf of government. So this is the thing. Microphone back to you, Alpha Alpha 4 Foxtrot Lima. This is VO3 Whiskey Tango Japan. Over.
Thank you for the report, Sir Sindhu. We appreciate you being here with us today. If you have any follow-up comments that you would like to make to the Marco group, feel free to post them on the Google group or listserv. We'd love to hear from you about any reports that are related to COVID research or vaccines, what is happening in India currently. So please do follow up with an email if you have additional conversations after you get a chance to think about it. Thank you for being with us, Sir Sindhu. I'm not sure exactly what hour it is, but I know it's not a favorable hour for staying up and being on the radio. We'll let you go, 673. Let's turn back to you for your final. VU3 WTJ Net Control AA4FL.
QSL Alpha Alpha 4 Foxtrot Lima. This is VU3 Whiskey Tango Japan returning. Yes, I am writing one article on vaccination drive conducting by Government of India, and I would like to submit it in the Marco group, and I will mail you that article. I am on it. Maybe within 15-20 days, I will send it to you. So this is for this. So 73. Bye bye. Have a good day. Over.
7-3, Sir Sindhu, and if any of our stations that are checked in, Sir Sindhu's email address on QRZ. If it's not, and you have a question, let me know, and I'll give you email address, and you might have specific questions that are a little better answered by email versus doing so here on the net. Thank you again, Sir Sindhu. Wonderful week. AA4FL Net Control from the Medical Amateur Radio Council. Do we have any other check-ins at this time? Go ahead and make your call. Okay, no other check-ins. We've been one time through. Are there any follow-up discussions, any questions, comments? If so, we'll make a list here. Go ahead and call me at Net Control, and I'll make that list, and then we'll have a second round. Go ahead and make your call, AA4FL.
PY2BBQ for a short comment.
Here we have two follow-up questions. I'm going to go ahead and let Howard and LML speak first, then we'll do Hilton. Go ahead, Howard.
Hey, I'm LML. Just one quick question. I'm not sure if any appropriate professionals are on the net to address it. Any thoughts on co-administration of the COVID, either vaccine or vaccine booster, with the flu shot versus doing them consecutively with the period in between? Is there any strong reason to be concerned one way over the other? I don't know what they're recommending at this end. Or
AFL Net Control. Thank you for the question, Howard. I'll make a list here of those who would like to answer that for Howard. Go ahead and make your call to Net Control.
Okay, A4FL, this is PY2BBQ. Just to say hello to Cassandra, and thanks for the he uses to confirm these QSOs as well in QRZ.com and LOTW. And to say that actually the Delta variant here in Brazil didn't worsen the scenario, probably because there was a high percentage of the population already vaccinated, and
And also we still keep the use of masks and most people working in home office work, and so probably that were the reasons why we didn't saw an increase of the number of cases with the Delta variant. And although it's more than 85% of the cases here in Brazil now are Delta variant. We saw a stabilization of the number of new cases and deaths, but not an increase so far. And I hope that will be the scenario from here on. And regarding vaccinations for the new variants, yes, they are being developed here by Butantan Institute. There is a vaccine in the phase 3 that includes the Delta variant, the Gamma variant, and others. And probably what is being said is that the coronavirus vaccine will be added to the influenza vaccine. It's possible that we will receive only one shot of vaccine in a year basis that will include the vaccine to coronavirus and to influenza as well. That's being studied. So back to net control, A4FL PY2BBQ.
PY2BBQ, thank you for that input, Hilton. So, Howard, I guess that answers the question in part. They're studying whether or not just to combine the two to have the annual booster. What I'm understanding from Hilton, both things are in one booster, so individuals are encouraged to have the influenza and the COVID vaccine all at once. So I think for influenza. So that looks like I'm doing science. Are there any other comments for Howard as to whether or not currently you can take both vaccines at the same time without negative effect? So please go ahead and make your call if you haven't answered that question.
WA1EXA.
N3IM.
Yeah. We have two responses for you, Howard. I'm going to go ahead and let Mark go first. WA1EXA, please go ahead and make your description and call.
WA1EXA here. Yeah, as I mentioned, I have one of my friends here from New York City area. He mentioned that at least some of the pharmacies, when people call, they ask them if they want to get shots at the same time. So one of the major chains, at least in the New York area, I don't know about around here because I haven't tried it, but at least in the New York area, ask the patient if you want to get them both at the same time. They didn't present any documentation about it, and but it is being done. Go ahead.
Okay, thank you, Mark. We did copy that some of them. I'm not sure if I'm having a problem on my end, but the audio dropped out. Keith, N3IM, some input from you, please.
Yeah, the CDC is now saying that receiving the COVID-19 vaccine at the same time you get the flu shot is safe and won't affect your immune response to either one. But they're also saying it's okay if you prefer to get them on separate dates. But they're saying that, yes, you can get them both at the same time and it has no effect on your immune response to either one of them. This is N3IM, back to A4FL in the group.
Thank you, Keith, and thank you for both of you for your response. I don't know how my speaker got muted, but I wasn't hearing you both. Are there any follow-up questions, Howard and N9OML? Go ahead and take the mic.
No, answers were perfect. Thank you, Jay, and thanks, gentlemen, on the net. My thought on that is that's a favorable situation. People have a reasonably good compliance with the habit of showing up for their annual flu shot, and by not entering an onerous additional visit, maybe we'll continue to get decent compliance with the flu shot and pick up stragglers on the initial vaccine or start getting people on their boosters as they're available to them. So I think that's probably the good news answer to hear, and I appreciate the time everybody gave responding to me. Thank you. As I know now, I cannot control cemetery.
Thank you for asking the question, Howard. N9OML AA4FL. Are there any other stations here before we bring the net to a close that have follow-up reports, questions, business? If so, make your call to AA4FL net control at this time. No additional comments requested. This is AA4FL net control for the Medical Amateur Radio Council, DVNet. For those of you that are listening, we meet every Saturday morning at 1500 UTC here on the QuadNet Array. And generally, this is a meeting of medical-related professionals who are members of MARCO. However, it's open to the general amateur public for those who'd like to ask questions and make comments, and we encourage check-ins from everyone. And we do appreciate the QuadNet Array and the technical ability to let us all speak to each other and transcode the different digital modes that we all use in our personal radios. That being said, 7-3 to all. Have a great week. We will pick this conversation up again next Saturday at 1500 UTC. Thank you for participating. AA4FL net to a close and opening it right back up to general usage. 7-3.
7-3, guys. See you next week. WA1 EXA.